All right, I wonder if I could have a motion to come back into regular session.
So moved.
Moved by Alderwoman Howman. Is there a second?
Second.
Second by Alderwoman Schmidt. Madam Clerk, would you call the roll?
Alderman Fruin,
Yes.
Alderman Lauer,
Yes.
Alderman Sage,
Yes.
Alderman Malumboy, Alderman Burgess. Yes. Alderman Painter,
Yes.
Alderman Schmidt,
Yes.
Alderman Black,
Yes.
Alderman Hallman.
Yes.
Okay, we're back in regular session, and I'm going to go ahead and turn it over to Mr. Juergens.
Thank you. Before we get on to the James Scott Trust, I believe there's an item on the agenda where we needed to report that we will be releasing, the council has given consent to release the transcript and new meeting minutes for the closed session meeting of November 15, 2013. So just pursuant to the Open Meetings Act, making that quick report. And now, if there are no questions on that, I will turn to a very quick presentation on the J.M. Scott Trust. First, starting with who was John M. Scott. He was an attorney from the city of Bloomington. My understanding is his house was actually right outside our city hall here at one point in time, and it was marked as such. He was actually the city clerk here for the city of Bloomington for a while, was a circuit court judge, was a Supreme Court justice in Illinois, and rode with Lincoln on the circuit. So a very distinguished resident from the city of Bloomington. When he died on January 1st of 1898, he left in his will wanting to establish a hospital for those who needed a hospital and medical care, and to create a trust to create that, and wanted the city of Bloomington to oversee that. By the time that the last annuitant passed away, it was 1981, and of course we already had two hospitals, various other medical facilities. So at that time, a trust was created, but the declaration of that trust was a little different than creating a hospital. It had other designs set forth in the council memo that was provided, but essentially called for the creation of the John M. Scott Healthcare Program. And the city of Bloomington serves as trustee. The city council serves as trustee of this trust. You are the official overseer of this program, and how the city has established this program, which is designed to do a multitude of things, is through an intergovernmental agreement with with Bloomington Township to serve as the administrator. And this is a few of the different things that the healthcare program has done. Not all of these things are still performed, but they provide caseworker and intake referrals, assessments. They've helped fund medical office visits. They provide some prescription medicine, both for mental health and otherwise. They've helped fund some adult dental care, preventative care, as well as pain management through extraction. They will, with the adult dental preventative care, they've had partnerships with various other dentists within the community. They've provided transportation for certain medical visits, as shown up there. They've, in the past, have helped fund vision services, which are no longer in existence, but where they helped pay for eyeglasses and exams. So the John M. Scott Healthcare Program has done a variety of things. Over the years, it's my understanding that they also helped pay for school physicals. There's also a time when they helped pay for air conditioners and fans for those who had respiratory issues. So a variety of different things designed to basically provide medical needs to those who could not afford it within the community and pursuant to the trust. Just real quick on the funding, and we'll talk a little bit more. This graph gets a little crazy, as you can tell up there, but one of the things that we're going to talk about tonight is what direction the program is going to go, what direction as trustee you would like to see some of these programs that are offered, some of the grants that are offered. For example, last year there was approximately $167,000 budgeted in grants, direct funding of various different entities, and then there was about another large portion that was budgeted for direct programs and services. So tonight we're going to talk a little bit more in detail about that. We have representatives from the John M. Scott Commission and Trust or Supervisor Skilrid here to discuss that a little bit as well. When we go back to this chart, we see that the trust creates the John M. Scott Healthcare Program, which again is designed to provide a multiple of things. Under that program, as part of that, we have the creation of the John M. Scott Commission, which is also created in this trust document. That's to advise and to assist with the programming. And again, then, we administer the program through an intergovernmental agreement with Bloomington Township. And Deb Skilworth, the current supervisor, is in charge of the administration of that program. So we fast forward a little bit. We've had the adoption of the Affordable Care Act, and a lot of the services that were once offered under this program are now no longer needed to certain populations. So with the Affordable Care Act, we've seen reductions in needs for office visits, dental, vision, prescription needs through the use of medical cards. The vision program is no longer offered by the McLean County Health Department. And so we've seen a lot of these programs no longer as necessary or needed with the current population that the program was serving. So tonight we come with this kind of fork in the road, and essentially what you're going to hear tonight are a couple of different visions for where this program could go. As you as trustee, where you could direct this. One vision that's being offered is from the commission, and they've come up with a recommendation, and again, you'll have an opportunity to hear from those associated with the commission to explain this a little further, to answer questions. They are essentially proposing that the intergovernmental agreement between the city and the township be dissolved, that the township no longer administer the John M. Scott Healthcare Program, instead that a 501c3 be created with the creation of a board of directors who would then make recommendations to the city. They want to work to assess and identify the priority health care needs. They want to be sure to maintain administrative costs around 10% of the annual budget. The big thing that they want to focus on, though, is converting to a grants-only program. Right now and historically, there have been direct services that have been provided by the John M. Scott Healthcare Program, as well as specific grants that have been provided. The commission is recommending that this be converted to a grants-only program. So there would no longer be that direct contact or those direct services offered like are currently offered out of the township. And accordingly, then they would want to provide direct funding to select entities who embody the intent of the Scott Trust. The other recommendation from the supervisor focuses on doing a complete document review and realignment, try and go back and look at the intergovernmental agreement, look at the bylaws of the commission, look at the trust, see if there are things that, in light of the changes with the Affordable Care Act, see if there are things that need to be updated and modified so that everything is reading a little bit better in concert, kind of improve some of the procedures that are being used. And one of the big ideas or things that the supervisor is recommending is that essentially right now the city council approves a budget for the John M. Scott Healthcare Program. One of the things that the supervisor is proposing is that budget be a lot more detailed and a lot more specific recommendations come to the council, and then the council would decide as this next bullet point, you would continue, the township and the program would continue to be an entry point for client services, but you would expand the eligibility guidelines. Right now, to be eligible for services, it's my understanding that you have to not have insurance, but you have to have income. Did I say that correctly? So one of the things Supervisor Skilrid will be recommending is to expand that eligibility so that it opens the doors to more people that are falling through the cracks, so that you provide assistance to those who maybe are in between getting some of the federal assistance or otherwise. Also to kind of continue and apply the community needs assessment, do more education regarding the program and increase participants in the program, and provide ultimately both grants and individual services, so that it's not a grants-only program. You continue to provide some of those direct services. One of the, when we talk about the finances, anytime you're dealing with a trust, you want to make sure that your administrative costs are as low as possible. And so that's something that I know both the commission and Supervisor Skilred have been focusing on and looking at those numbers. And under both proposals, you'll see where they're looking to have a very low in overhead for what's going to be provided. And I'll let them talk more about their specific proposals, answer any questions that the council has, and I'll try and answer any questions as well. But before I turn it over to them, is there anything?
Questions? Alderwoman Burgess.
Yeah, I have two questions. First, I'm just trying to make sure I understand things organizationally. Do you know who prepared the commission bylaws? Were those prepared by the commission or were those prepared by the city council? Okay. Okay.
Do we, and Tom Herr is here, who serves as the attorney for the trust as well. That's something we could look into and see if we can find.
And just to clarify that, if this was a question to Mr. Herr's role, who does he actually represent? I mean, because if we're the trustee of the township, we didn't approve his contract necessarily. Who does he represent?
Well, do you want to answer that?
Okay, thanks.
Our firm has been involved since the inception.
Could you come to the microphone, please? Thank you.
Thank you, council members, mayor. Our firm has been involved since the inception. My dating goes back to 2009 when I became involved with this, but our firm, Richard T. Dunn, originally filed the petition to have the will converted to a trust. That dates back to 1981 or 1982. We've been involved in some capacity.
That inception, not the 18.
Not 18, that's correct.
Okay.
It was originally, a petition was filed at that time. It is a court-supervised trust. And so we have been serving as counsel for the entity, at least within those court proceedings, since that date. John Yoder, also an attorney from Bloomington, is serving as a guardian ad litem. Every 5 years, we have filed an annual or a report reporting the receipts and disbursements similar to a trust accounting. So our involvement has been from the inception, and we represent the entity. So, but this is a court-supervised trust. The Attorney General's office reviews these reports. The guardian ad litem reviews the reports, and
So you're you don't necessarily represent us,
well,
or I mean, in terms of people, who do you represent?
I don't represent any individuals. I represent the entity.
Okay.
Right.
Thank you.
Okay.
I did have a second question for
Please.
Jeff.
Oh, I'm sorry.
That's okay. So it's my understanding that this entity is relatively unusual in that it is atypical for a government public body to be named as a trustee of private funds. Can you maybe just give us a little bit more information about what our role is as a trustee of these funds and how it may be different than what else we do as council members?
Yeah, and this also might be something Tom can help me answer better because I'm not a trust attorney, but, and Tom, feel free to jump in here, but obviously as trustee for the trust, you've got to act in a fiduciary capacity. You've got to make sure that the intent of the trust is being, fulfilled, the terms of the trust are being fulfilled. This trust started in 1981 with about $5.4 million. It has grown to today to have about $11.4 million. So the assets of the trust are extremely healthy. I think, for many years, the trust was doing fine. The program was being implemented. There were not a lot of issues. As I said, I think we've come to a fork in the road where now there are a couple of different visions as to what this program should be. And that's where, in my opinion, it falls back on you as the trustee to help give some direction and some clarification as to where you want this trust to go. Now, the commission was created as part of the trust, and they're there to advise you on the programming. They're there to advise you on these types of things. They're made up of professionals in this field. And so certainly that is something, they've come forward with a recommendation. And then you've got Deb Skilroot, who's the supervisor, who's come forward with a recommendation. Is there anything I missed on kind of the fiduciary obligations or?
In answer to your question, I think first you look to the terms of the trust as to your duties, roles, powers, responsibilities. One of the big concerns we have whenever you have an entity as trustee of another entity is, and you delegate, is what is the scope of your ability to delegate authority? And so over the years, the city as trustee has taken the right steps. Whenever there was a duty to delegate, or whenever that was proposed, there was a petition with the court file, a petition filed with the court to outline what those either the agreements were or the original trust agreement. There was an amendment to the trust at one point in time with respect to investment authority. So the only thing I would add is whatever is done here should be approved by the court, and that gives the trustee protection.
But just from the very beginning, though, this was trusted with the elected officials of the city of Bloomington,
Correct.
even back to 1898. So would
No,
that?
no, that's not correct.
That's not true?
The original trust appointed the city council. I'm sorry, the original will. The trust mirrored that appointment as city council, but that was not until 1981 that the city had any authority over this trust.
So what happened in the ensuing 83 years?
It was being paid to annuitants.
Oh, okay.
Yeah. So
I see.
yes.
Okay. Thank you very much for clarifying that. Thanks. Anything else?
Just very quickly, because I want to hear from the folks that are here, but I think we had an aldermatic subgroup or something that did some work with this. I know I would appreciate hearing from those three folks as well, some of their, insights and reflections as well. So thanks.
Okay. All right. So we start with Ms. Gilruth, or who? Or who starts first? Okay.
Susan Albee with the commissioner. Are you the president or is chairman?
Sure. Then I'll be Grant. I will add that. So thank you for listening to us tonight. And I think that we actually all share the same vision, and our goal is to be good stewards of Judge Scott's money because he gave it as a gift to the citizens of Bloomington originally, and we've kind of expanded it to McLean County. Our concern is pretty much financial at this point. We feel Judge Scott's money is being spent inappropriately. We're spending way more than what should be spent on administrative costs as a charitable trust. Last year it was over 50% went to administrative costs. And I have provided, I don't know if you guys got, we did a little outbreak from 2003 to the present, and at no time has the administrative costs been under 38%, and they've been as high as 54%. For a charitable trust, that's really not a great idea. The Attorney General agrees it should be between 10 and 20%, and the lower you can keep it, the better. Obviously, the more people you can help. Last year, we helped very few people. Medical office visits were 5 in 2015. 3 in 2016, but yet we're paying the Scott Trust is paying nearly $7,000 a month for personnel and benefits. That is not going to help the citizens of the county that Judge Scott intended to help.
Is that part of the transition because of the Affordable Care Act?
It is. The Affordable Care Act brought the folks that the trust used to help are now all eligible for Medicaid. And I personally, I'm a nurse, I'm a registered nurse. I don't think that the Affordable Care Act is going to go away anytime soon. And part of the trust's goal is also not to duplicate services. So if someone has a payer source such as Medicaid, it would not be a very wise decision to use Judge Scott's money to pay for something that's already covered by government.
Sure. But you're not making the claim that it cost us nearly $100,000 for 5 office visits?
For all of the services that Jeff referred to, we're paying, the Scott money is paying a large amount for administrative costs for people to sit in offices and answer phones, but the phones aren't ringing and people aren't coming in the door because the eligibility says that if you have Medicaid, you're not eligible for John Scott.
Other questions? Okay.
I don't know if anybody else has anything else.
Maybe we could just review the services that are currently being provided.
Well, I think
There's-
maybe Ms. Skilward will probably do that.
Okay, well,
Yeah,
I'm
she-
just hoping that we can get on
Right.
the same page there. Thanks.
Right, no, excellent point.
We're doing an excellent job with transportation to the cancer center. That's probably the biggest need. But in our proposal for grants, we see us being able to provide grants to an agency who already does provide services. We're not talking about taking the services away from people. We're talking about giving them to people who are already doing it much more efficiently than we are through the trust currently.
Okay, all
Okay,
right, thank you.
thanks.
If you'll hang tight, because we might have follow-up questions. Mr. Jurbans, you wanted to say?
No, I'm just going to go to the next slide for Deb.
Okay, Deb, go ahead.
I do have a document that I'd like to pass around. This document is an updated version which separates out program salaries and benefits from admin salaries and benefits.
Okay. Do the others, Sue, Donna, others, do you have copies of this? We'll remedy that right now.
Yep.
And the media. Go ahead, Deb.
Okay, so in review of this, the document that Chairman Grant had created did not separate out programs, salaries and benefits from the admin salaries and benefits. And when you are granting out to other organizations for the work that needs to be done, those services are those services are passed on to the grantors, or the ones we're granting to, so that your program costs stay with wherever the program is. All right? So if you look at this document, you will see with the program costs, program salaries and benefits separated out on the left side of your spreadsheet. On the right side, where admin costs are there, we are considerably low. We're 3% all the way through 2010, and then it became 10%, 9%. You see additionally that the the percentage of admin costs goes up right about the time of 2012. That is when the early retirement incentive started needing to be paid back. And so that cost, if you remove the 19,877 per year for the 6 years, it's a 6-year thing, and then you remove some of the consultant fees for strategic planning, and then you also, best case scenario would be provide grant funding for all the grant funds that were budgeted. Then you are really at the 10%, 11% or 10% of the admin costs. So you're really low, and we are in line. Township is doing, we are good stewards of this. It's just needed that programs needed to be removed from that program admin. Okay. You will see in program salaries and benefits that from 2014 down, when Affordable Care Act took place, there was a reduction in the program salaries and benefits, with the increase moving more toward grants so that we could still serve the people. So there's a balancing act here where the program, if you're dropping your programs and services and you're dropping your grants, automatically your administrative costs are going to go high. We were trying, and it was approved to be able to provide $167,000 worth of grant funding to serve the people. And with the decrease in the direct services and not the grants, the full amount of grants taking place, that artificially inflates your admin costs. So in the best case scenario, if all the grants were provided and the ERI was out of there and the cost for the consultant, we'd be right in line. All right? I want to share with you that in response to the programs and services decreasing, Affordable Care Act did take place and it did decrease the direct services, but the need is still there, and Township is the entry point for those needs. We see that every day. We know what's going on. There are 3 particular areas that I want to address that could be removed as a restriction. Our hands are tied at Township right now because yes, Affordable Care Act took care of those who are on Medicaid and managed care. So if somebody's on Medicaid and they come to our front window or they call on the phone, we can't help you, you have Medicaid. Well, that's not entirely true. They have Medicaid, but their services are not all provided for. Some of those services are extreme. You have three scenarios that I want to address in terms of how we could potentially move forward for the direct services. Now, I believe that direct services need to still be maintained so that we're the face for the people who need it, for the ever-changing Affordable Care Act. It might not go away, but it's going to change again, and it'll change again after that. And the needs are still there. They're just different needs, all right? So, first example is currently we're unable to help those who have no viable income, and I think Jeff addressed that, but hearing it again might help. It's confusing, but no viable income. So, if you don't have a job, you don't have any income coming in from unemployment, we can't see you. All right, but who are the people who need it right then and there? Township no longer pays medical care and hospital care because of the Affordable Care Act. All right, so these people are falling through the cracks. Some of their services can be provided for, but if we can't see them if they have no income at this point. So I suggest that we open that up and then help those individuals. Secondly, open up to help those who have Medicaid for services not covered. So if you do have Medicaid, we can't see you. But there are services that are not being provided for those people who are on Medicaid, such as some dental, like preventative dental, root canals, and such. Some of the, state Medicaid does not pay any provision for preventative dental cleaning. So, well, I got to think through that one again, but preventative dental, gum disease, a lot of these individuals who need surgeries can't get surgeries because their periodontal work needs to be done before they can have the surgery. That's not covered. So the third thing is opening up to eligibility for those with Medicaid managed care. There are many individuals who come to us and they can't meet their deductibles because Medicaid managed care is very similar to Medicare donut hole. We cover at John M. Scott, we cover Medicare donut hole, which is that time frame where prescriptions, they have to meet a certain dollar value before the prescriptions are kicked back into Medicare. So it's like this donut hole of a situation that we do take care of, but we're not matching that with the Medicaid side of things. For the spend down, we're not covering or helping with those prescriptions. So you have somebody as a diabetic who needs their insulin. They can't get it because they can't afford $300 or $400 for their insulin because they don't have any income or they just can't afford it. That's monthly without any medical coverage. So these are the types of things that exist today. And I'm trying to say, direct service is a must. We can't recognize those services unless we're here seeing it and then doing something about it. The other thing I want to talk about is the 501c3 briefly, or changing to a whole different package. I believe in righting the ship, not sinking it or abandoning it. The costs associated with changing this to a 501c3 are huge. Right now, I don't know if any of you really understand, but through the city and through the township, whether this program is with the township or goes back to the city as it once was before. Originally it was at township, then it went to the city. You can read that in your 1981 recommendation and framework. But right now, the loss of the city or township support is a large list. I'm going to repeat some of these things because it is large. Audits, rent, utilities, which is electric, water, gas, sewer, garbage, computer services, technical support, hardware and software, internet, business liability insurance, which is TORMA, workers' comp, liability, snow removal, and mowing, supplies, paper, toilet paper, tissues, pens, stamps, all of that, janitorial services, long-distance phone service, building maintenance, repair, pest and insect control, Plumbing, electric, water heater, all of those things that break down occasionally. Fax line is now, their fax line is no longer with Scott Health. I reduced that, and we're using one fax line for both at no cost to John M. Scott. And then financial management through the city. That's partly the audit at the city, partly an audit at the township, so it's a dual audit sort of thing. Ours is for day-to-day operations, and the city manages the financials from there. So converting to the 501c3 would just be, a huge cost. All of that would have to be set up when all we really need to focus on is aligning the documents and opening it up and seeing how we can write this and make it happen. The way it was intended to happen was to be direct service and link to the individuals who need it most and who need that individual care. Do you have any questions?
Questions of Ms. Gilroy? Alderwoman Schmidt?
This isn't directly, well, I do have one question. I'm still, when I look at this particular recommendation, I don't understand what the role of the commission would be. My second question, I think, is just for all of us. I'm hearing two pretty different sets of numbers, and I'd like to see them. I need to understand more about the Scott Commission numbers. I need to see them side by side because this is a new piece of information. So,
And I want to add to that, if you don't mind, because I can enlighten you a little bit on that. When the strategic planning meeting came into play in 2015, I provided those documents to the strategic planning, or to the Scott Commission. Those documents didn't separate out the admin versus the program.
Okay, but I just think for the benefit of all of us,
Of course.
that it would be very helpful for us to have that factual side-by-side comparison so we can dig through it, and I see some nods from over there.
Okay. Start with Alderwoman Burgess, Millawambwe, and Sage.
All right, time is short, so I will try my best to be brief. I've had the opportunity and the pleasure of speaking to both the commission and Ms. Gilroyd in her role as the administrator of this program, and it's very encouraging to see such a large group of individuals who have the best interests of Judge Scott in mind. And I think the fact that we have competing suggestions today, and will have moving forward, it sounds like, because I don't think we're going to make a decision today, is not a sign that anyone has done anything wrong or deviated from that. We're just now trying to figure out the best way to move forward to make sure that Judge Scott's gift to the people of the city of Bloomington is used in its best manner. And so I think we're very fortunate in that regard. I think it's going to take us a little bit of time as a city council to sort this out and figure out what the best step moving forward is. But I think it's not for lack of wonderful people who are helping to guide us in that nature. It's just, we just need to figure out what's best. So I thank all of you for coming to us and bringing this to our attention so that we can do our role as trustees.
Millawambwe and Sage.
Sure, thank you. And I think I'm going to speak along the same lines. When you have, first of all, I don't doubt the fact that everybody wants the best, for for this particular entity. But I think when you have people who are so close to the issues, obviously everybody's convinced that they have the right solution. What I'm really wondering, because you've provided a lot of numbers and a lot of different facts, but what I'm wondering is if we could get an I don't want to use objective because I don't want to make it sound like you're not objective. Any of you are not objective. But maybe somebody who is a little bit more removed from this to provide an analysis of all the numbers. Because obviously when you are when you're projecting into the future, there is no certainty, and at least for myself, I like to have a little bit more certainty about where we're going because it's important that we be very careful with these funds.
So you're asking for more information. I think we're hearing that.
Right,
I'm
more
only
information and
nudging because we've got quite a few people who want to talk.
I know we've always been accused of having too many consultants or things like that, but I wonder if we could get somebody else, to take a look at all the different, the competing.
I think we could.
Especially
Locally, we
with the
could find
projected
someone.
idea that
Right.
is moving forward.
Okay.
I think that's a smart idea. to do.
Alderman Sage, and then Black and Fruin, we got to go.
So again, at some point, and probably it appears this is going to carry over to another conversation, but I, again, I would be interested in hearing from the alderman who served on that group, what perhaps maybe not, maybe recommendation is too strong, but I'd like to hear what their thinking is, because they've been representing the city council in this process. So I'm not, Karen?
Amelia and Jim.
Okay, all right. So that would help me.
And maybe they can work with staff to figure out what kinds of information might be the most important for us to have that is systematic on both sides, or all sides.
Because in some respects, they bring some of that third-party perspective that
Right,
Mboka
right.
was just talking about. Maybe not in deep dive on the financial, but some of that perspective.
Yeah, excellent.
Mayor,
Okay.
could I just made a point of order on the time, and talking with Jeff Jurgens, you could continue in and then start the township board meeting when you're ready. So I just wanted to let you know that. And Jeff, do you want to just comment on
I was
that?
just going to say, if you want to take a few more minutes on this, and we did not anticipate that you would come to a decision tonight, but I do think it would be helpful, and a couple of you have said this, if there is additional information you think would be helpful for you, let us know that. We can try and work and get that. And, this is really just the start of the conversation to help everybody figure
Okay,
this out.
let's see if we can finish this up in 5 minutes, and then we can go forward. Alderman Black, Fruin, and Lauer, again, be mindful, we're trying to get out in 5 minutes. Okay.
Absolutely. Thank you. And thank you everyone who's come, Susan and Deb, for speaking. You can just feel the passion about J.M. Scott and making sure that his money is used in the best possible way. I'm looking at these numbers and this was kind of passed out right before the meeting, and I really appreciate the detail here. I know that we've spoken before, Susan, on some of the numbers you provided, and it makes me smirk because it reminds me of a conversation that Sage and I were just having, that you can parse these numbers out in a lot of different ways, and we can argue about how much the fax line is taking in versus this admin cost, and there really will never be an ultimate outcome. But to me, this discussion is more of a, do we want to move to a grants-only program, or do we want to be continuing the direct services? So I don't know if I'd necessarily be interested in looking at more numbers finance-wise. I don't know if we can ever come to a true agreement on what these actually mean. But I think philosophically we have to decide, do we want to move to the grants or services? And I would just say, if we go to the grants discussion, I'd want to get a clear understanding of what a board of directors looks like, who's on it, how are they appointed, how do they get on, how do they get off, because I don't want to see a situation in which, say, we want to have a doctor or somebody. We obviously want to have someone who's competent and understands the content, but we don't want them pushing grants in the direction of organizations that they're involved with, or declining ones of competition. So that's a question I'd want to have answered, and that's I guess where I'm at. And I'd be curious to know at some point, because I don't want this lingering on forever, if we can give a definitive end date on when we come back on this conversation.
Right, no, I think that's an excellent point. And obviously, that's a political kind of question that we have to decide, and it's a classic question. If you're going to go to an appointed board, where's the accountability? Right now, the accountability. Deb Skilrud runs for re-election. Council, mayor, there's some degree of accountability. An appointed board, the degrees of accountability, need to be clear at the very least. Alderman Fruin and Lauer, and then, thanks.
Thank you. I'll try to keep this short. In my background, my thinking probably comes from most of my career being in healthcare in an insurance capacity, working with both the hospitals and working with a community healthcare clinic. So that's the extent of my healthcare in the community. I'll first start out and say we're very fortunate to have Deb, to have her passion and her contribution in the township. $11 million is a lot of money, so we've got an important task here. And I've thought about this, and I'll just get ahead of myself a little bit and say that I'm more interested in a community health professional group managing this Scott Commission as opposed to a city council or board of trustees. I don't want to get too far ahead of myself, but township supervisors, if you go back 20 years, we've had 4 different supervisors. They come and go. We hope you're here for a long time, Deb. Council members come and go at a more frequent rate. I would rather have what I would hope would be the stability and the professionalism of the healthcare in the community managing this Scott money. As far as everyday services, I think that can be addressed through the National Healthcare Program, whatever you want to call that, through the Community Healthcare Clinic, through least choices, emergency rooms, et cetera. But I think there's plenty of opportunities for daily services. I like the grant concept. Right now, we're going through this whole mental health need in the community. I think that would be a great example where some grants could be applied. Um, and I just want to do our very best to minimize administrative cost and minimize duplication of community services. So that's in a nutshell, and I don't want to get too far ahead of myself, but I'm kind of a community managed versus a government managed person.
Alderman
A
Flowers.
piece of information I think that we could all use, and I like the idea of having some healthcare professionals involved. Uh, a little bit more complete patient needs assessment or customer needs assessment, where this money is really needed now. The demographics have changed due to the Affordable Care Act, and I think that we've got some needs out there that probably aren't being recognized. I think Deb can highlight some of those. Maybe some of the other folks on the board can highlight some others. And I think what we're looking at is where we weigh those out, and no matter who makes that decision, I think we need a fair look at what needs are actually out there right now. Thanks.
Right. Okay. And just also to clarify, we do have the healthcare professionals are involved in Scott right now as an advisory capacity. And so I don't think anybody's suggesting that that goes away. Okay. At this point, we will continue this at another exciting episode. Can we, Mr. Hales?
I'd like to turn to Jeff, and maybe do you have any recommendations on next steps?
Yeah, number one, I think we want to get this resolved as soon as possible. I think we want to get that direction. Is that correct, Tom? Yeah, that's correct. So we will probably come back to you within the next couple of meetings for some additional discussion and potential direction. If you can be emailing me any questions that we've had some good discussion, some good, things that are being asked for. We can work on providing that through Deb and the commission, get you that information. If you have other questions that come in your mind, feel free to get those to us. We'll try and get that answered. At a very high level, again, be thinking, and I know some of this key information you still need, but, be thinking about this idea of do you want to do grants? Do you want to do services? Do you want to do a mix? And then the next question is going to be, once we decide on that, what's the delivery method going to be for those? So a couple of different questions, but the first question is going to be, that issue of grants or grants and direct services. So.
Okay. All right. Thank you very much. At this point, is there a motion to adjourn? Is there moved by